they said to us it was good for garbage, they would harvest the organs and kill him. And they would unplug him as of November 29th. That's Quebec healthcare system for you.
In a social media post from his son's hospital room in New Orleans, Louisiana, Montreal father Nicolas Tetrault rips into Quebec's healthcare system.
Yeah, so they told me basically that we should consider absolutely harvesting the organs. That was the right thing to do. They were promoting this almost like a religion.
In October, 2.5-year-old Arthur Tetrault drowned in the backyard pool of a home the family was renting in Île Bizarre.
He was dead when I took him out of the pool. His lips were black, his fingertips were black.
CPR, a trip to the Lakeshore General Emergency Department. Eventually, Arthur was transferred to the Montreal Children's.
They decided unilaterally that Arthur had no chance of survival, couldn't breathe on his own, would be basically in a vegetative state for the next years of his life.
But after doing some of his own research on treatments for drowning victims, Tetrault found Dr. Paul Harch in New Orleans, a specialist on hyperbaric oxygen treatment. Harch claims he's had incredible results in several young victims with brain injuries.
It's a wide range of effect. Some we got who are walking and talking now. Others, it's along a whole range.
Harch has collaborated with Montreal doctor Pierre Marois.
I was surprised that they were thinking about removing any life support at that time. It was not 3 years after the drowning.
Tetrault asked doctors in Montreal to give Arthur the treatment. They said no. Hyperbaric treatment is not approved by Health Canada to treat drowning victims.
They said it's witchcraft. All the doctors in the US are all imbeciles.
If a doctor cannot explain a therapy and have an understanding, they don't refer people for it.
Tetrault pulled every string he could and got Arthur down to Oxnard Medical Center in Louisiana.
The retirement plan, we just called the broker, sell whatever you have.
He says Arthur had been heavily sedated and that just weaning the boy off the meds has brought optimism.
The baby's a million times better, doesn't need a ventilator. Needs nothing.
To him, the case underscores differences between the Canadian and American systems.
The parents are treated as a client, so there's changes the entire approach, whereas in Canada, we're seen as a source of expense.
Medical malpractice lawyer Patrick Martin-Menard says Quebec's public system does lack customer service culture, that he's witnessed unpleasant, condescending behavior from medical professionals.
This type of attitude is very present here in the Quebec healthcare system.
But he wonders if a system that comes with significant financial barriers is really better.
It's not as a clear black and white thing.
The Montreal Children's Hospital said in a statement its decisions are based on best practices, that organ donation never factors into discussions about neuroprognosis, and that hyperbaric oxygen is not offered for treatment of oxygen deprivation brain injuries in Quebec. Dr. Christopher Labos recognizes that any parent will spare no expense to save a child.
There are valid medical treatments that we can use hyperbaric oxygen for. I don't know that there's any evidence to suggest that you could use it for, a post-drowning case. That seems a little bit outside of what the evidence would suggest.
Arthur should begin hyperbaric oxygen treatment this week. Tetrault says he's finally been able to sleep.
I really feel that there's hope.
Tetrault's social media posts of Arthur's path have gone viral. His spending is in the six figures. Whether or not his son is ever able to walk or talk again remains unknown. Tetrault plans to dedicate part of his life to helping drowning victims gain access to treatments. Dan Spector, Global News, Montreal.